Well, good morning, everyone, and welcome to A Word from Washington Health System. Thanks for attending. We hope everybody's doing well. My name is Brian Schill, and I'm the Executive Director for the Peters Township Chamber of Commerce, and facilitating with me is Kelly Keene, our Operations Coordinator. The Chamber is a 501c6 membership-based nonprofit. We receive no government funding. Funding is primarily composed of each member's annual investment and events, and in this case, non-events. Our chamber mission is to provide connections, opportunities, partnerships, and resources to grow our businesses and serve our communities. Or quite simply, we promote, we advocate, connect, and educate. In addition to Peters Township, our area of coverage also includes the South Hills and Northern Washington County. Joining us today from the Washington Health System, we have Dr. John Six and Ms. Sarah Schumacher. Good morning.
Good morning.
Good morning.
Hope you're doing well. So Dr. Six is the Vice President of Medical Affairs and the Chief Medical Officer at Washington Health System. He sits on a number of boards and committees in the area, but most recently he joined forces with other physician leaders in Western PA to share insight, plans, goals, etc., for serving the community during the current COVID-19 outbreak. This group is called the Regional Chief Medical Officer Collaborative Group. The health systems in this group include the Washington Health System, Heritage Valley, Excella, Butler, St. Clair, the VA Healthcare System, UPMC, and AHN. It's quite an impressive group. Sarah is the Executive Director of the Washington Health System Foundation. She's a graduate of IUP, where she majored in journalism. Sarah and Dr. Six both graduated from McGuffey High School, small world, and have known one another since they were kids. So I guess that's the past 15 years, right? So
I didn't put the decades in there for a reason.
She also sits on a number of boards, including our Peters Township Chamber Board, and she volunteers for various other organizations throughout our community, especially another one with our partner, Junior Achievement. So a little Zoom 101 for everybody today. I would ask that you please remain muted during the entire update. This will eliminate any background noise. This webinar is being recorded. Following Dr. Six and Sarah, when they're finished, we'll have some Q&A. You can use the chat feature to ask your question. It's located at the bottom of your screen, the chat button. Dr. Six and Ms. Schumacher will be answering some of the frequently asked questions they are receiving at WHS. So Dr. Six, let's start with you. Can you give us an update on the current state of the Washington Health System and in our region?
Absolutely. So I wanted to start by saying thank you to Brian and Kelly for the invitation, and that from the Peters Township Chamber of Commerce. We certainly appreciate it. And also thanks to our Washington Health System team members for really pulling together during these unprecedented times. And thanks to the greater Washington community for all the outpouring of support. And so, yeah, several questions that we get as to what's the current state of the health system and what are we doing to prepare for that? And there are several things. So we started this journey probably back in mid-February. And then since that time, we've significantly ramped up our resources and meetings. So we opened our command center, for example, in March, mid-March, and this includes our entire administrative team and our clinical team so that we have dedicated time every day to meet. We also then have a phone briefing at 12 noon, and this goes out to all of our department directors, division chiefs, and department chairs. And then we'll follow that up with a daily memo to the health system employees and staff detailing the decisions that have been made, where we're at currently, and where we need to go. Several weeks ago, we instituted a no visitor policy, and this was for the protection of our patients and our employees. So with rare exceptions, those exceptions being end of life or for our OB patients, we're not having visitors, and this would include representatives that are coming in to the hospital and deliveries. And when someone does come in, we're screening them with screening questions and also temperatures at the door. As a result of keeping our staff safe and our patients safe, we've also had several different closures or reductions in services. So keeping with the governor's mandate several weeks ago, we've canceled elective surgeries, and we're only proceeding with emergent and elective procedures through the end of April. We've also canceled several of our elective radiology and cardiology procedures, again, only moving forward with emergent and urgent procedures. And then we've also had to cancel physical therapy, occupational therapy, cardiac rehab, and children's therapy. Again, this is in response to keeping our patients and our staff safe. Overall, we've seen a reduction in our outpatient volumes, sometimes up to 50%. We've seen surgeries decrease to single-digit numbers, which we haven't seen for quite some time. And overall, our emergency department volume has decreased. Normally, we would see upwards of 150 a day, and at times we're seeing less than 30. And overall, our inpatient census has decreased. This is all at the same time that we're trying to ramp up services in order to respond to this pandemic. So on one hand, services are being decreased to protect patients and staff, and on the other hand, we're preparing for the patients that we are treating with COVID-19 symptoms and also the potential surge. So from an inpatient perspective, we've developed several different COVID-19 specific areas within the hospital. We have a specific floor dedicated, a unit dedicated to COVID-19 patients that are either positive or at risk. We've also done the several changes to our critical care unit, again, dividing that into the areas that are COVID specific and non-specific, and also with our emergency department. These same changes extend to our Washington Health System Green Hospital, including the unit specific floor there and also the emergency department. In addition, we wanted to respond to the community need for testing, and so we have set up two different outpatient centers, one at the Wellness Way at the Cameron Wellness Center for drive-through testing, and another one at the Medical Arts Building in Washington Health System Green. And again, in staying with the opportunity to respond to the surge, we've also had several specific surge plans. These surge plans include our critical care unit, our emergency department, and also our physicians and advanced practice providers. That allows us to be able to flex up our critical care beds from 27 beds up to 50. That allows us to ramp up our ventilator use. It allows us to also take the different pods of the emergency department and make them COVID specific with overflows to our observation unit. At the same time, we've recruited physician members to be able to cross-train into the critical care unit or the emergency department, and also to take our nursing staff and at times repurpose them through cross-training so that if they were on the floor and previously in the critical care unit, they could go back and forth. So that's sort of the lay of the land, and I'll stop there.
Sounds good. What does this mean financially for you folks?
Sure. I can start with that, and then let Sarah certainly jump in with her expertise. But financially, it is difficult. As you see, we have historically moved to a lot of outpatient procedures over the last several years. And certainly revenue has decreased as we've had to pull back on those services, whether they be elective services or even our outpatient services. So sometimes we've seen upwards of a 50% reduction in those revenues. And so that's balancing at the same time that we're trying to ramp up COVID-19 specific services. So there's certainly a balance there. We look at these numbers every day. We've done the very best to be able to take our current staff members and repurpose them and to retrain them, cross-train them so that they can fit into different areas within our organization to keep everyone on board. But it's certainly a struggle, and we're not unique to this. So certainly you had mentioned earlier about the collaboration that we have amongst the 7 regional health systems and the chief medical officer call. And we are hearing this and seeing this across the region. And we're doing our very best to balance this.
Let's talk about testing a little bit. I mean, it's very interesting to me because it's been sort of controversial, you know, how long they're taking, the procedures, who can be tested. And you mentioned we have 2 spaces, one sort of near to us is the Cameron Wellness Center. Could you talk a little bit about the turnaround times and things like that?
Absolutely. So overall, if we go back 2 to 3 weeks, testing was very limited. And of course, that was not specific to us, but rather nationally and then certainly regionally. So we were being very careful with the testings that we had. These tests are not initially done within the health system. They are collected within the health system, but then they are a send out. And we use a particular laboratory that was, of course, inundated with the testing that was going across regionally and across the nation. To date, we've collected and processed over 1,000 COVID-19 samples. And then we've had, a positivity rate that's somewhere between 4 and 5%. Initially, we were seeing turnaround times that were highly variable. We would see 4 to 5 days. Sometimes they would take 7 to 10 days. And again, this was dependent upon our test site that we were sending out to, and everyone was across the country. Initially, it was going to Virginia, then it was going out to California. As testing has become more robust and as these labs have begun to catch up, we are seeing turnaround times now around 24 to 36 hours. So again, these are ones that are being collected through the nose or through the oropharynx, the nasopharynx, through the drive-throughs. But we've also recently acquired in-house testing, and this is through a system called BD Panther. This allows us to turn samples in-house and to be able to use them in a very judicious manner, and we have turnaround times there around 3 hours. So I think we are finally catching up. We have been diligent, and our lab directors have been diligent about obtaining the materials, the media to be able to do this testing, but it has been limited, and as soon as we get it, we're out there testing again.
Do you feel confident with the number of test kits that you currently have?
I'm confident today. Who knows what that will mean tomorrow? So certainly one of the things that we're all trying to predict is if and when the surge comes. So certainly Western Pennsylvania and Washington County to date, knock on wood, has been relatively unscathed in terms of total numbers. Certainly, we do have numbers. Certainly, we are treating these individuals and their families. But at the same time, we're not seeing the numbers that are seeing in Allegheny County, across other parts of Pennsylvania, and specifically on the eastern side. So with the current amount of testing that we have for our outpatients and then also for these limited in-house testing, I am comfortable with the numbers that we have now. But as we continue to gather more and more ability to test, we want to expand that opportunity to test to those pre-surgical patients, to those obstetrical patients, to those patients that are at higher risk that previously did not have the opportunity to have testing because it wasn't available.
One more question regarding the testing kits, because I just want to make sure it's clear. I, like many folks until this morning, get most of our information from the media. So somebody who's listening to this, what do you recommend if they think they're feeling symptoms or they want to be tested? Can you talk about that for a second?
Absolutely. So I think it first starts with how acutely ill are you feeling. So, on one hand, to have signs and symptoms, whether it's fever or cough, some mild shortness of breath, and to even have a low-grade fever. If you're otherwise comfortable and otherwise able to call your doctor's office, we would certainly start with that. Many of our providers are now doing the telemedicine and teleconsults, and also doing, of course, limited testing in their offices, but would be to start with a phone call to your physician. He or she could then provide you, depending upon what your symptoms are, with some thoughts, recommendations, treatments, and then also provide the ability to do testing. Certainly, on the other end, there are those individuals that are in extremis. So if you are short of breath, if you have difficulty breathing, if your fever has been unabated and you are feeling worse, then we would encourage you to be seen in our emergency department. We do have screening processes in both of our health system hospitals outside the emergency department, where we're pre-screening there and then directing them to different areas of our emergency department. So it really kind of depends on how you're feeling. We'd either encourage you to reach out to your physician, or certainly, if necessary, visit our emergency department and/or call 911.
Okay. Something else that I noticed that's very interesting when I'm watching the number of cases. Washington County, in my opinion, seems to be on the lower end of the amount of cases. Could you chat about that for a second as well? What you think might be contributing to that?
Yeah, and that's a great question, and frankly, it's hard to be able to answer that. We know that our county and our health system in particular has been very diligent from the get-go about three primarily important things, and that includes hand hygiene, social distancing, and then also the use of masks, whether they be the surgical masks or the more protective N95s or MaxSayers here in the health system, but also the cloth masks that we also have here within the walls of the hospital and also for our community. It's really hard to know why specifically we've had less cases. You know, some of that certainly can be a geographic based upon the separations from the river, the bridges. It also could be due to the density of the population. Certainly, we're seeing those higher and more dense populations, including, of course, our Allegheny County colleagues, but also in the areas of Philadelphia and New York, of course, with that dense population. So I think it's highly variable. Time will tell. Some projections say that we may have had any surge that we would expect. Others would say that it could be another week or two, that this could extend for several more weeks into months. It's kind of hard to predict.
Thank you. How about staffing? You hear a lot about staffing too, because you know it's really taxing on your staff. If you think about it, if you try to put yourself, you know, folks like myself into your shoes, you know, whether it's doctors or nurses or any of the other folks, how is your staffing doing, and how are your staffing levels? Are you hiring?
Sure. Well, we're certainly hiring in select circumstances for sure. So there are critical positions that are always going to be needed, and for which we would be hiring. And so these are certainly ongoing. Of course, of the staff that we have now that are being repositioned or being cross-trained, we're certainly utilizing what we have currently. At the same time, we will be starting the phone interviews, doing pre-screening, just to make sure that both our staff are safe and the interviewee coming in. At the same time, the morale of staff, interestingly enough, has been very good. We will do rounding within the health system on a daily basis, both clinically and administratively. And I think that one of the most important things has been the communication. So our CEO, Mr. Brooke Ward, has done a fantastic job of communicating to all of the staff members the things that we're doing to keep them safe and to keep our patients safe. And so I think communication has been key, so that everyone seems to be on the same page. The outpouring of support from the community has been uplifting too. So from the delivery of candies and cakes, and Sarah certainly can talk about this, and the food, you know, it just shows that we're all in this together, and it's been encouraging. So despite the somewhat stressful circumstances that some health systems are seeing and the stressors financially, I think the outpouring from support from the community has really kept our spirits high.
Thank you. Just do us one big favor and please extend our sincere gratitude to everyone out there in the front lines. I know you sort of see it a little bit, but I think it's never enough. So if you would do that for us, we really appreciate it. And it's
sure.
sort of something related. I mean, can we talk a little bit of, I mean, the new buzz is PPE. So what are your thoughts on your PPE, the status and your levels and things like that?
Absolutely, and I certainly would, encourage Sarah to give us some idea about the donations and the other things that have been going on. But the personal protective equipment has been an issue, certainly nationally. I think we are fortunate here within the health system that through our materials management, we have been very successful in obtaining and maintaining the personal protective equipment. So this includes gowns, gloves, mask, eye protection. We've certainly been able to procure that from different resources that we have, and at the same time, we've had a tremendously gracious community that has provided anything that they've had from community resources. Overall, I think that our current stock is adequate for where we are at today. Again, that always depends, much like staffing and much like finances, what happens in the future. We have been very diligent from very early on as making sure that we're using this in the most appropriate and the smartest way possible. So we are protecting our staff and our patients, but at the same time not overusing the equipment. So it is certainly a challenge. It's numbers that we look at each and every day. We try to plan if there is a surge, do we have 1 week, 2 weeks, 3 weeks of material left, and how soon can we get that? There has been a recent, late last week, governor's executive order that we do an inventory of this. And so the inventory is being reported to PEMA, which is the Pennsylvania Emergency Medical Authority. And so what we are doing now is looking at how much PPE do we have, how many gowns, how many masks, how much eye protection, medications that we have, how many beds are we currently utilizing, both inpatient beds and critical care beds, and then also our ventilator use. And I think from a total perspective across the state, this is important so that we all know where we're at in the event that a colleague health system needs help, that ability to be able to know what each and every one of us has. We don't anticipate that we would need to utilize that, but in the event that we need to take care of more than our own community, we're certainly there to help.
Thank you. We do have a question here. Who qualifies for your in-house testing program?
Sure. So from an in-house testing program, that specifically is looking at our BD Panther Fusion system. So this is the 3-hour turnaround time. So we have several different criteria. So this is going to be on a case-by-case basis, because at this point we're sitting on around 130 opportunities or kits to be able to test. So first, we will look at those that have been admitted from the emergency department that are now an inpatient. And this will help us to determine, are they going to be in an isolation specific area, how much PPE would be using, et cetera. So it will allow us to look at whether they are one particular spot in the hospital or another. Another area that of course happens is in our critical care unit, again, having specific COVID in non-specific areas. We'll also look at patients that are in-house that will be going back to a skilled nursing facility. So in order to help risk stratify them, we know whether they're COVID positive or COVID negative, and helps us to be able to help with discharge planning. So we try to look at these on a case-by-case basis to help us risk stratify, to help us determine which part of the hospital we're going to have placement, and then also with protecting our staff with the personal protective equipment.
Thank you. Let's maybe switch over, give you a little break for a second there, and bring Sarah on board. And Sarah, let's start with you. Maybe if you want to talk a little bit about the PPE and anything else that you got going there at the foundation.
Sure. So thank you, Brian and Kelly, for having us here today. And I echo a lot of what Dr. Six has already said. The one thing that I think is worth mentioning, and may sound a little bit like bragging, but it's worth it anyway, is that I honestly have never been so proud to work for the Washington Health System. Most of you know that I worked here right out of college and was here for 9 years, left for a short time and came back. And honestly, our leadership has just done an outstanding job, including Dr. Six. And I think it's good for the community to be reassured and know that we are prepared as much as we can be, and the staff is prepared, and they really feel very strongly about taking care of our community. So I think it's worth saying that because I've been exposed to a lot of it, and I've just been truly proud and honored to be a part of all of this. So there's that. And thank you guys for helping to get the message out today. You know, part of what I have the opportunity to do is to provide a little bit of a silver lining for everyone. So I get to be involved in the good work that's being done in the community. And so Dr. Six definitely stated a couple of those things, and PPE seems to be the hot ticket item. So I wanted to, again, I'm sure some of you on the phone call today have supported our efforts. You have given personally or professionally or supported us in some way. And so the PPE has been great because it gives the health system some reassurance that when we are not able to obtain, as Dr. Six had said, you know, it's been difficult to find suppliers and quantities, and we know we have this additional supply, and it makes our staff feel at ease too, because they know that we have enough of it, and they're going to be protected. So I wanted to give a huge shout out and thank you. Some of the businesses literally brought just truckloads and pallets full of masks and gowns, and you know, some of our own board members, Alex Paris and Range Resources, and we just literally every day continue to receive them. So from the bottom of our heart, you know, we can't say thank you enough. It is certainly different times in the world, and it's different times in the fundraising world. I really never thought that we'd be here soliciting people for things such as protective equipment for our staff, but it's pretty awesome to know that the community steps up when they're asked to, both individuals and of course organizations who had those items. Brian, the other thing I wanted to mention, you know, PPE has been on the top of everyone's mind, but one of the other things that we've received in terms of PPE is the cotton or homemade masks that, again, Dr. Six referenced, but has been just an outpouring of our community who literally, some of them dusted off their sewing machines and others use them regularly. And just to give you a slight example, we have received almost 1,400 of these masks, and I myself am one of the individuals who uses them because they are used for non-patient care to give us some protection and then also to protect one another. And so to not have those cotton masks at this point would be challenging for the health system, because we'd be using resources on ourselves, those who aren't with a patient but need to come to work every day and need to protect ourselves from one another and what we may have been exposed to. You know, that's a heartfelt thank you from me personally, and also for the rest of our employees who are wearing them every day. And I know that they have been an organized group of people who have spent not just hours, but they've spent weeks putting plans together to make these masks. So I really wanted to give a heartfelt thank you to all of you who've been involved with that. And if you know someone who has, it's been a pretty awesome thing to see. In addition to that, we have received an outpouring of support, and I know from some of you on this call, of meals. And again, that was mentioned earlier. I have been a professional fundraiser for 18 years, and I have seen a lot of generosity and I've seen a lot of kindness. And I can honestly tell you that I have never seen anything like this before, where people are inundating us. And I say that in a very kind way, but I literally can't keep up with the amount of phone calls and emails and text messages of people who want to do something to help. And they want to help our patients, but they want to help our staff, because they know that they're the folks who are taking care of the patients, and they're the ones who perhaps again, who need a little bit of a pick-me-up. And I think I would agree that that's part of why the morale here has been pretty good. And the folks that I have talked with are just happy every day that they can come and do something meaningful to help people. And I think the meals that have been provided, the surprises that keep coming, the Saris candy, and K&L Gates bought popcorn from Popcorn Willie's. And I mean, I could go on and on and on. We have more than 250 people or organizations who have donated things such as PPE and meals for our staff and care packages, which we keep putting together weekly. The smiles that we get from the staff when we bring over a box of snacks and food for them. Hopefully Dr. Six has gotten to see some of that and gotten to partake in some of it. You know, it's the little things in life that really make the biggest difference. And I think that's some of what we're seeing. And for me, that's really the silver lining in all of this, is that our community isn't worried about themselves. They're worried about all of us. And how are we handling it today? But more importantly, how are we going to handle it, and how are we going to be when this is all quote unquote over? And so I really hope that my profession has been community healthcare. And I hope that at the end of the day, that's really what they think about, is what's the impact that community healthcare has, not just today, but tomorrow. We often think of healthcare as being something that the older generation utilizes, or people with chronic illnesses. But it takes something like this for those of us who are a little younger to realize we need a strong health system in our community every day. Because just like this pandemic, we had no idea this was coming. But what I did know is that the Washington health system was already prepared in some sense and had great leadership to be able to take care of what's going on right now. So honestly, the biggest message, I know I'm a fundraiser and I want to tell you, please contribute and keep making cash donations, which I'm going to talk about here in a second. And thanks some folks, Brian. But you know, the biggest takeaway for me is, how are we going to be when this is all over? And is the realization of how important community healthcare is right here in Washington County. That's the message, is that we're here for the long haul. So thank you, Dr. Six, for that. I see him, he's nodding, because hopefully he agrees with that as well.
Absolutely.
And then lastly, I wanted to talk a little bit about the cash contributions that have come in. And of course, I'm a fundraiser, so I would be remiss if I did not talk about how important that is. We have been able to purchase additional protective equipment for our staff based off of some of those donations. We are able to invest in things like telemedicine and telehealth, whether that's laptops for the physicians to be able to utilize, whether that's webcams, or blood pressure cuffs for patients who need to be able to check their blood pressure at home, to give that and provide that to their physician. You know, those are the things that really matter right now. And those are the things that the $25 gift or the $25,000 gift are helping us to be able to provide. You heard Dr. Six mention the financial portion of all of this. And Brian, thank you for asking that question, because I think from a fundraising perspective, that's important as well. Again, we're talking about the viability of the future of our health system, as well as the current state of how we're trying to get through this pandemic in the best way that we know how. And your financial support has and will continue to be a part of that. And I know people are getting creative. Brian and I were just talking about the Washington Rotary and some of the other organizations who have gone to their members, like the Marcellus Shale Coalition, and they've said, hey, can you guys support, and we'll do it all in one group. So they're pulling their funds together, and then they're contributing them to the health system so that we can utilize them to purchase infection control equipment so that our staff can make sure that they are safe, our elevators are clean, taking the time of what would have been an hour to clean an elevator that had potentially a COVID suspect or COVID positive patient down to a 10-minute turnaround. So if you think about, you know, we just got done saying we're down in some areas with staffing, and we need that vital time to be able to turn around and make sure that we can move on to the next phase. So, you know, I literally wrote down a bunch of things here because, as I said, 250 donors. I'd like to thank each and every one of you. The last thing that I wanted to mention were the restaurants and the local small businesses. I know that a lot of folks that are calling me on a daily basis are saying to me, first and foremost, I want to help the healthcare workers, and I want them to know that we're here for them, and I want to do something good for them. But please, as small business owners, know that they're also saying to us, we want to do this, but we want to help the small businesses too. And we want to purchase the food from them, and we want to patronize them so that when we're on the other side of this, that we're all viable and we're all back to a point where we're functioning in a forward positive motion. And so I think it's important for the chamber to know that, because not only does the community care about us as healthcare workers, but you care about one another. And we want to see everyone succeed and come out on the other side of this in a great way. So that's the silver lining for me. That's what gets me out of bed every morning. That's what gives me sweet dreams at night, and knowing that we're going to come out of this okay.
Thank you. Just a couple comments, because you mentioned it several times about the leadership. I got a kick out of it when we first posted this on Facebook. There was some mention that Dr. Six was awesome, or he's the best, or something like that. So I thought that was pretty cool.
Thank you.
No problem. You love to see that, so especially for a
Very
CMO.
nice.
Yeah, so that's good. I just want to reiterate a little bit, because we did talk about the Rotary, and I was talking to the Washington Rotary on a webinar yesterday, and I would challenge all the clubs out there, the philanthropy clubs, all the Rotary groups and things like that, to the Lions and those folks that have those monies out there that they're given. I think it's a really good time, and it's a really good opportunity. It keeps the money in the community. We always struggle with that as Rotarians with that. So this would be a good time to maybe contact Sarah and put that out there. I mean, even to you as individuals. I don't know if it's particularly happened, but I mean, when you donate or you work with a small a restaurant or a caterer to do, you're actually helping 3 people. You are helping yourself, because you have the pleasure of, that feeling of assistance. You're helping the restaurant because you're spending money at their restaurant. And of course, you're helping those healthcare workers to keep up the morale. And it's very good to hear, Dr. Six, that the morale is great there at the hospital. So, but let's see, let's go back to some of the questions here. To Dr. Six, how will WHS fit into the new normal? There is a lot of testing that seems to be on the horizon. Has WHS had any early discussion about how they will be involved?
Sure. Yeah. So that's a great question, and I assume that this is probably talking about some of the more COVID-19 specific testing that is coming down the pike. And so we have had several discussions organizationally across the health system, but also in the regional call and collaboration that we have with the other 6 health systems in the area. So some of this testing is certainly being validated and looked at. So right now we don't have an FDA-approved specific test that we are able to utilize here within the health system. It doesn't mean that it won't exist. It just means that it's still a little ways off. But what we are looking at is the ability to do that serum or blood testing, to look at the antibody response, and to really get an idea of who has been exposed, who has maybe an active asymptomatic case, and then those that have responded. So I think that will certainly, from an epidemiological standpoint, give us a lot more data. Unfortunately, because this is also very new from mid to late December, this is taking a little bit of time to catch up. But I'm certainly comfortable and confident where we're at regionally. We do have 2 very large academic health systems within our region that are on the forefront, and we certainly have lots of assistance there. So although it doesn't exist to date, I am very encouraged that it's coming down the pipe, and we will be certainly there at the forefront with the opportunity to test our patients and staff alike.
Thank you. We have a question here. I'm sort of going to summarize. Is there anywhere that's available to find out, how many folks have been hospitalized, how many are on ventilators, how many have recovered and been released, something like that? Is that information out there anywhere with regarding to Washington Health System?
So specific to the health system, what we do is we share that information with our department directors, our chiefs, and division chairs. It is not necessarily something that we have published publicly, At the same time, there are several different resources across the state. So there is what's called a knowledge center, and this is an area within the emergency response community and the collaborations that we have with the county EMS and then also with state EMS. And so this is an area, and they have a dashboard, HAP, or the Hospital Association of Pennsylvania, have a dashboard where you're able to view this information. Although we are specifically talking about Washington County, because we do not have our own county health department and we use the Pennsylvania Department of Health as our surrogate, we do look at the Pennsylvania Department of Health site for several of our statistics. If you're looking for Allegheny County specific, they do have a dashboard for that county, but again, they have their own county health department. Several of us, of course, utilize different resources, and one of which that is quite popular and I think has lots of good information is the Johns Hopkins website. So it really varies. I will tell you that all of that information is very helpful. It's quite interesting. At the same time, there's a bit of caution when looking at that because things change on an hourly basis, and things change certainly on a daily and weekly basis. And sometimes there is a delay. Not that that doesn't make the information good and valid, because it is, but I just caution you that there is some delay. So what you're looking at could be several days to a week old.
A couple questions here regarding therapies. Have you guys found any therapies that are working? Have you guys been using hydroxychloroquine or anything like that?
Yeah, great. So that's a great question. And certainly what we do know is nationally there are ongoing trials to be able to definitively tell whether or not these are going to be proven treatments. And when we think about that as a scientific community, we think about randomized, double-blind, placebo-controlled trials. So those are things that are ongoing. Here within the health system, certainly based upon clinician judgment. So when we're talking about our critical care physicians, the intensivist, in select cases, there is the opportunity to use the hydroxychloroquine and the azithromycin along with zinc. So what we do is we will look at each specific case, our critical care physicians that are highly trained, looking at the data on a daily basis and making the best informed decision with their patients.
Okay, I think we have one more question here. Let's maybe fill it in with this. Will there be an antibody test available to test people who think they may have the COVID-19 and recovered without medical care?
Again, a great question, and I think that maybe alludes a little bit to some of what we talked about a little bit earlier, but there are several different things that are on the horizon. Fortunately or unfortunately, we're just at a point where this is so new that a lot of this is taking time to ramp up based upon what data is available, what data isn't available, and how much production capacity is there to do this. So yes, when we think about antibody testing and what's called IgG and IgM, the ability to determine whether someone is currently infected or whether they have had infection in the past and then have had it resolved, that is on the horizon. That's not something that we are currently doing as a health system, but this is just a matter of time. And I think that will give us a much better idea of what is going on in our community and what's going on nationally, because we do know that there is a large portion of folks that are asymptomatic or they are very low symptoms, and they may have had this infection, but for whatever reason, based upon their comorbidities, which are their other health problems and or age demographics, they may not have had a significant issue with the infection itself. But I think we're going to see as antibody testing ramps up that there was quite a bit of exposure, not only here locally, but regionally and across the nation.
Thank you. Any closing comments, Dr. Six?
Well, I just wanted to say, you know, Sarah and I have worked and lived professionally and personally in this community for the longest period of time, and it has been very gratifying to see the response from the community. So I'm humbled by the opportunity to work within this health system, to work with the leaders that are here and the clinicians and the support staff. As Sarah had mentioned, I mean, it's just a great group of individuals, and also seeing the selfless acts of the community members to support us through this pandemic has been very gratifying. And I would just close by saying, you know, just important to keep these three things in mind, of course, is the hand hygiene, making sure that you wash your hands as much as possible. Certainly thinking about the social distancing and maintaining that distancing, not only where you work and live, but also when you're out in the community. And then finally, wearing the mask. And what we can promise you is that you would be pleased with what we have done to date and what we plan to do in the future to keep our community safe, to keep our patients safe, and to keep our staff safe, and so that we can continue to provide the quality care, the great patient care that we have done and that we will continue to do as this pandemic unfolds and we get back to normal sometime in the future.
Thank you. Sarah, would you like to add anything?
Absolutely. So I also wanted to just give another thank you. And as I've been telling our foundation board, there never has been a more meaningful, or I'll even say exciting, time to be a philanthropist than it is right now. And being a philanthropist means a lot of things. It means giving of your time, giving of yourself, and giving, of course, of the resources you have, whether that is in-kind items or that is a cash donation. So I just wanted to reiterate that and thank everyone who is on the call and those who may be watching it later. And then I also wanted to mention that every week our president and CEO, Brooke Ward, is doing a video update on Fridays, and he's answering some of the questions that are coming up every week. And as we've both said here today, things are changing rapidly. And just when we think we sort of have it down, there's something else that comes down the pike. And so Brooke wants to be able to address those things to make sure that our community is up to date. And I think he's doing a great job, because I think if we get out in front of it and you hear from our leadership exactly what we're doing, then there's no question and no way to misinterpret the information. So I would encourage everyone to look us up on Facebook and to please like our page. And in addition to that, our website is full of some great information. I know that, of course, there's some national information that's out there, but we also have information on our website at www.whs.org. And so if I can be of help to anyone, or you would like to contribute to the efforts or find out how you can help more specifically, you also can reach out to me or anyone in the foundation at any point. So thank you very much again to the Chamber. I did want to say that, you know, Brian and Kelly do a great job all the time, but these are trying times for everyone, and we're all sort of trying to figure out what our new normal is and how can we contribute in the area in which our expertise is. And I think that you guys have done a great job doing things like this, trying to switch gears very quickly to figure out how can you support the business community in the times that we're in right now. And so I just want to say thank you to you guys, because I probably have been sort of in my own bubble for a little while and haven't had the opportunity to tell you. You guys are doing a great job, and I think you're supporting the community to the best of your ability with the times that we have and the resources that we have. So thank you for that, and thank you so much for having me on today.
Thank you, Sarah. And thank you again, Dr. Six. We really appreciate what you're doing out there. And again, please extend our sincere thanks to everyone at the Washington Health System. Just to close, I just want to let everybody know the Chamber is open for business, albeit remotely. The physical office is closed. If you'd like to get in touch with us, email is probably best at info@ptcoc.org. You can always call 724-941-6345. Again, 724-941-6345. With Kelly, she'll check the messages 2 or 3 times a day to make sure we're keeping up with those. I want to let you know about our new Facebook group that we started, the PT Chamber Community Support group. That has a lot of the updates and things that are going on. You'll see the recording for this there as well. Also, our website is www.ptcoc.org. So we have information on there, and usually we have our regular Facebook page as well. So thanks again to the Washington Health System, to Dr. Six, to Sarah, and to all of you. Stay well, my friends, and have a great day.